Hi everyone, welcome to another episode of Simply Heal. And again, we have our regular Dr. Jansen with us today.
Hi, hello Sean, hello everyone. Glad to be here again and welcome to Simply Heal.
Today, Doc, we want to talk about a very exciting aspect of cancer treatment, which is immunotherapy.
Yes.
Doc, the thing that struck me most about conventional immunotherapy, or really for conventional immunotherapy, is that we always have the understanding that when you go for immunotherapy, the drugs will strengthen our immune system, and that's how we defeat cancer.
Okay.
Is that the right understanding? Because you were telling me actually immunotherapy is like vaccination.
Yeah. So what you just said is wrong. Okay.
Oh, it's wrong, everybody. Okay, so immunotherapy is not to strengthen your immune system. So how does it fight cancer then?
Okay. Immunotherapy. So with the words, right? Keywords. Immuno, which means immune system. Then therapeutic. Yeah. So with this class of anti-cancer drugs, it's basically using your immune system to destroy the cancer cells. Okay, so how does it do that? It does not boost in whatever way your immune system. What it does is to help your immune system recognize the cancer. Okay? In that way, it's really similar to vaccines. So vaccines, as everyone already knows how vaccines work, right? So the vaccines is it's the virus itself without the fangs. Okay, so it's given to you so that your immune system would be able to recognize the virus without the fangs, no? So that the next time that you get infected with the virus enters your body the next time around, your immune system can easily overwhelm the virus. So it's sort of like, helping the immune system recognize, okay, this is the enemy. Okay, so immunotherapy also works in that way, right? So I'll give you a specific example right now.
All right.
Okay, so for all of those, for those of you who are breast cancer patients, okay, breast cancer has a certain type, okay, HER2 positive. I'm sure those breast cancer patients out there
will know what that is.
Yeah, will know what this is, what I'm talking about. Okay, so if you get HER2 positive breast cancer, okay, as a drug that is always given to you is Trastuzumab. Trastuzumab, the proprietary name, Trastuzumab is the generic name. The proprietary name is Herceptin. If you are familiar with that, no. So what Trastuzumab does is, okay, first, what is Trastuzumab? Trastuzumab is a monoclonal antibody. Okay, so antibody. Okay, so the pill in itself has antibodies for what? For recognizing the HER2 receptor. So HER2 is a receptor that is expressed on the surface of the breast cancer cell. Okay? Now, usually when HER2 is when you're HER2 positive, usually that's aggressive. But with that HER2 positive receptor poking out of the breast cancer cell and you being given Trastuzumab, the Trastuzumab will function as a bridge between your immune system and that breast cancer cell, so that your immune system can recognize, okay, this is the breast cancer cell, I will destroy the breast cancer cell. Okay, so that's how it functions.
So Doc, clearly it means that we always, I was one of them too, and I think many of the patients, maybe even some patients who are going for immunotherapy today, your understanding of how immunotherapy works might be that common misconception, is that the drug that you're taking is strengthening your T cells, your NK cells, the cells that kill the tumor. No, it's not. Immunotherapy creates the bridge between your immune system and the cancer cell. So it helps your body recognize the cancer cell. Doc, for conventional immunotherapy, that means the one that we get from our oncologist, the normal protocol is first to combine it with chemotherapy?
Usually, but it's case to case. But more often, depends on the stage as well, no? If you are on a more advanced stage, usually what oncologists do is to start you on chemotherapy first. Then once you're done with chemotherapy, they start you on immunotherapy.
Why the chemotherapy first?
I would surmise, no? It's because number one, chemotherapy can be given for a shorter period of time. Because immunotherapy, usually you would have to be on it for around 2 years. Okay, so longer period of time. So, but aside from the timing, okay, it's because chemotherapy is sort of like a nuclear bomb. So you bomb all of the cancer cells first.
Make them weak.
Make them weak. Try to shrink them enough so that your immune system, once you are already given immunotherapy, your immune system can, easily pick off the smaller bits and pieces of the tumor or the cancer cells. Okay, so it sort of like works like that. And also, why chemotherapy? Why do we need it? I'm always, if you have noticed, I'm always advocating should use all options that is available for you.
All options.
All options. It's because cancer cells can evade the immune system. In the first place, that's why they grew. It's because they were able to evade the immune system in the first place. Okay? That's why it's there. So now, with that, knowing that, it's not enough to boost your immune system alone. Yeah, it's not enough to give you immunotherapy alone. Okay? You should be able to kill off those cancer cells that has been evading your immune system. Okay? And then afterwards, then target the
ones that your immune system can recognize.
Okay? To target the more specific, the smaller cells. Because in that way, it's easier to pick off smaller bits and pieces of cancer cells rather than a big chunk of tumor, right? It's always very difficult to fight cancer if the headquarters is there. Okay, so that's also one of the reasons why, we need surgery as well. Okay.
Wow, Doc, thank you for that very clear explanation. And Doc, how would you then position or share how does Simply Nature's liquid extract work as a natural immunotherapy?
Okay. So Simply Nature PPARS liquid works in both phases, the chemotherapy and the immunotherapy phase. Now, the benefit of the Simply Nature liquid extract in the chemotherapy phase is to preserve your bone marrow. Okay? So one of the side effects of chemotherapy, I'm sure all of you know, your blood cells count usually decrease. You get anemia,
both your red and white blood cell counts.
Everything. Okay, so your platelets, your white blood cell count, your red blood cell count, those decrease. Why? It's because chemotherapy can be toxic to the bone marrow. The bone marrow is where these blood cells form. Okay?
So Doc, it's so important. If any of our patients and listeners are planning to go for immunotherapy, which is expensive, and they have to go for chemotherapy first, then it's imperative. It's so important that they protect their bone marrow, because if the bone marrow is compromised due to the chemotherapy, the immunotherapy
it won't work as
won't work as well. So to all our viewers on the program, if you are ever planning to use immunotherapy and you have to go for chemotherapy first, then do something to protect your bone marrow, because your immunotherapy does not strengthen the soldiers that are produced by the bone marrow. The immunotherapy provides the bridge for your soldiers to recognize the cancer cells. Now, if your bone marrow is destroyed, the immunotherapy's efficacy will also drop.
Yes.
All right.
Exactly.
Exactly. All right. Now, Doc, we know that our PPAR liquid extract, Simply Nature's PPAR liquid extract, protects the bone marrow, but our extract also improves dendritic cells. So, am I correct to say, because you helped explain that the vaccine or the immunotherapy, I'll use terms that for our viewers easier to relate. So, the immunotherapy is like a vaccine for the cancer. It's tailored to a particular strain of cancer.
Yes.
And cancer can mutate, but often not so much. But there is a chance.
There's a chance.
So that would mean that it's important for your own dendritic cells to also do their job.
Yes, they should be able to do their job well as well.
So PPARS liquid extract would actually work together with immunotherapy. The immunotherapy drug will send most of your soldiers to attack the main tumor because your soldiers can now recognize the cancer tumor. But it is important for your dendritic cells to still be working. You cannot depend only on the immunotherapy drug, because what if your cancer mutates differently from the immunotherapy drug? Then you really need your own body's dendritic cells to identify this small breakaway guerrilla force and kill it before it becomes recurrence, right?
Yes.
Yeah, because you can have a successful immunotherapy after chemotherapy and you can go into remission.
Yeah.
But the recurrence happened because it broke off,
Mhm.
escape detection, because this new strain was not designed for the immunotherapy drug. Just like we now ask, right, for COVID-19, whether Sinovac is effective, and it's true that Pfizer is the most effective.
Yeah.
So Pfizer dealt with mutation much better than AstraZeneca and Sinovac. So it very could happen to you also that your immunotherapy for your particular cancer might not deal with the mutation as well. So you need to make sure your own dendritic cells are active. And for that, it is proven Simply Nature PPARS liquid extract improves dendritic cell activity.
Yeah, and not only dendritic cells, okay? It has been shown, an observational study, dendritic cells, not only dendritic cells increase, but the natural killer cells, which is actually the soldier that destroys all foreign bodies, all abnormal cells, okay? It's the natural killer cells also increase, your T cells also increase. Okay, so that's that's also one of the benefits of
So that
liquid
means,
extracts.
Doc, I mean, from what you are sharing right now, it sounds like that the immunotherapy drug, conventional immunotherapy drug, strengthens the bridge, but does not strengthen the soldier.
Yes.
However, Simply Nature liquid extract strengthens the soldier. So that means it's a good pair up.
Yeah, it's a good pair up. It's actually should be almost always given together. Yeah, but I would the strategy that I would do is to give PPARS extract first before you go for the immunotherapy.
Oh, strengthen the soldiers first.
Strengthen the soldiers first, make it really sensitive, then give the bridge.
Give the bridge, and the soldiers will cross the bridge and
Cross the
attack
bridge,
the cancer cell and help you win the battle, win your fight against cancer.
Yes.
Doc, I think we've highlighted so many interesting facts. I hope that the viewers are really getting understanding because we're seeing questions come up. So let's go to our Ask Me Anything session, and I'm quite sure there'll be lots of questions about immunotherapy today.
Yeah. All right. See you in the Q&A.